Let's talk about SBAR, Situation Background Assessment Recommendation. I bet a lot of us have been waiting for this for a long time. I just want to talk about it informally, not what you see on Google, typical Google or ChatGPT something. Let's discuss it. What is SBAR? I know a lot of us don't use SBAR from our home country. I mean, myself, I never used it when I was in Nigeria. I don't know about the places in Nigeria. Some places, some hospitals that are posh might be using it, but I worked in places where I never got to use it. Okay, I worked in health centers, primary health care, what's it called, private health center, private care, like private hospitals, little private hospitals, health centers and all that. So I didn't get to work in those posh places that might use SBAR. So I never knew what SBAR was until I came to the UK, and then I was introduced to it during my OSCE examination. And currently this is what I use to take care of my patient. This is what I use to hand over. This is what I use to discuss my patient care with a multidisciplinary team. Okay, so what is SBAR? SBAR, we start from the situation, which is the S. It's just, first of all, discussing what is wrong with this patient. Why are you coming to me to tell me about this patient? What are you concerned about with this patient? You know, you're coming to a doctor, for instance, to discuss a patient to the doctor, that you want the doctor to come and see the patient. So you have to know why you're coming to that doctor in the first place. That is your situation. Okay, so if you're handing over to a patient, a colleague as well, you know, the situation is what has happened to, like, what is currently happening with this patient. That is the situation. But if you're talking with a doctor, discussing with a doctor, you want the doctor to come and review your patient or something, what is happening with this patient currently, that is my situation. So that situation for you, and it can include if you're a midwife or a midwifery student or a midwifery whatever it is, or in a midwifery background generally. It has to include the gestation, it has to include the parity, gravida 1 para not, gravida 3 para not, gravida something para something, or if the lady is delivered para 1 or para 5 or para 4. And then is there what is currently happening in current situation? Why are you concerned? Is this patient bleeding? Okay, was this patient admitted for bleeding? Yes. Okay, gravida 1 para not, how many weeks gestation is this person currently? Say 38 weeks gestation, or 38 plus 5, 38 plus 2. And then what is currently happening? Oh, my patient was admitted for PV bleed, was admitted for bleeding, was admitted for reduced fetal movement. Those are your situation. Okay, you can also include in the situation if the patient is high risk or low risk. Okay, is this patient generally low risk before coming to the hospital with bleeding, or is this patient high risk before? So high risk patients can include patients that have, say for instance, gestational diabetes mellitus, pregnancy induced hypertension, preeclampsia, things like that constitutes high risk patients. So is this patient high risk or low risk? Has this patient been seen by the consultant before? Is this patient meant to deliver in the birth center, a low risk Betty unit? You know, just include a line to say if the patient is high risk or low risk under the situation. Like I said, the gestation, the parity, whether high risk or low risk should be included in that place, and also what this patient is presenting with currently. So PV bleeding, reduced fetal movement, whatsoever it is, put it in under the situation. Then we go to the background, which is the B. What is background? Background is everything, you know, that has been happening with this patient before, what this patient comes with generally. Okay, so background can include all your histories, your medical history, obstetric history, medication history, social history, you know, what you've done before. All of them can be in the background. Like what has been done for this patient before can also be in the background. And also very important, allergies. Under medications, you know, before I even start the medication, I always used to put the allergy up there, and I put it in red so that everybody will see it whenever they come, if I'm documenting. But if I'm talking to the you know, doctors also about it, you know, you put it under the background. But make sure that if you're documenting, it has to be in red so that they see it on time. But really, it's under the medications, medical history, and all those blah blah blah. If there's a way you can put it up first, it's very good, so that I can see it before any other thing. And then, like I said, the background is all your histories. So medical history, for instance, oh, does this patient have anemia in the past? Does this patient have hypertension before? Does this patient have what's I'm looking for a very good okay, diabetes as a medical history. Whatever it is that is the history, put it there. Obstetric history, has this patient had an SVD before, spontaneous vaginal delivery, or has had an emergency cesarean section, or has had a miscarriage? Whatsoever it is that is the obstetric history, put it there. Does this patient have fibroids? Does this patient have cervical atrophy? hydropion, you want to put it there. And most importantly, make sure to take note of the relevant background and relevant histories. So for instance, this patient is coming with PV bleed, pervaginal bleeding as the situation, and under the background you see a medical history, you see cervical hydropion. You know that, okay, probably this is related. It might be that this patient is bleeding from her hydropion. You understand? So that is why it's very important for you to give a very detailed SBAR when handing over care to your medical colleague or so. All right, so the medication history, what medications is this patient currently on? You want to be talking about them as well, because it will inform their care. It will inform their care. The patient is not going to be already taking medications and the doctor is prescribing more of those same medications or similar medications for him or her. It will be too much. So it's very important for you to put the relevant medication history, social history, obstetric history. Also, the scans that this patient has had is under the background as well. So if you're in a midwifery background, the ultrasound scan that this patient has had should come under the background as well. The blood test that the patient has had before you started the care should come under the background. So the HB, the iron level, which is HB, the blood group, all of those antibodies and all that should come under the background of this patient. Okay, and then social history as well. If there's any safeguarding concerns with this patient, should come under there. Then the assessment is what you have now done for this patient today, what you've done for this patient in this care. All right, like before you came to hand this patient over, before you came to talk to me as a doctor about this patient, what have you done? Okay, have you done the observations, the blood pressure? Have you done the recent lab testing, like blood tests? What have you done? Have you done palpation? What exactly have you done? Have you done a speculum? Have you done an examination per vagina? What exactly have you done for this patient? Okay, you want to be talking about them in the assessment. You have to make sure. I'm not going to have to tell you that you should do a vaginal examination when the patient is bleeding, because there is a risk of placenta previa, the placenta coming before. You don't want to aggravate that, so try to avoid examination per vagina when there's a risk of bleeding. Generally, you want to maybe do a speculum, get the doctors to review and all that. So under the assessment, what have you done? Have you done a speculum? Have you done whatever it is you've done? You want to be listing them under the assessment, the observations, blood pressure check, and every other thing. Then the recommendation is the arrow. Recommendation or plan of care. My recommendation: I want you to come and review this patient. I want you to come and see this patient. At least I've told you what I've done. I've told you what is wrong with this patient. I've told you what the patient presented with. Now my recommendation is that I want you to come and review this patient. I want you to come and see this patient. I want you to prescribe so and so medication for this patient. I want you, what you want that person to do, that you're telling that person about this patient in the first place, is your recommendation. Your plan of care as well is, for instance, you're documenting, you're using it to care for your patient in the room, one-on-one care. Your recommendation is what you're going to be doing for this patient going forward in this one-on-one. So your patient is in labor, active labor, you're rendering one-to-one care. You're documenting on the notes and all that, and you've written your situation, your background, your assessment, your recommendation. Your recommendation in that instance would be what you're going to be doing for this patient. Are you going to be doing 4-hourly observations, blood pressure? Are you going to be doing epidural check every hour, epidural blood check? Are you going to be doing things like that are what you're going to be listing under the recommendation, the things you hope to do for this patient throughout your caring for this patient in this shift. You want to write them down, under your plan of care or recommendation. So like we said, situation is the S, background is B, A is assessment, and arrow is recommendation or plan of care. It can be used for nursing or midwifery context or situations. For nursing, it's not much different. It's still the same thing. Situation is what is happening with the patient. Background, what are the background histories for this patient, the history, past history for this patient. Assessment, what has been done, what you've done for this patient, in this current situation. And then the recommendation, what you want the person to do for you, or what you want to do for the patient, is basically the same thing. I hope you understand. Let me know if you have any questions in the comment section. Don't forget to like this video, share with your friends, subscribe to this channel. I love you. Thank you very much. Have a nice day. Bye.